to provide her presentation.
Thank you so much, Shale. And I want to thank our Colorado Resiliency Office for the opportunity to do just this, to provide this presentation. I'm excited that we're all together to have this discussion, and a little challenged by the fact that, as Dr. Carcason said, these are pretty wicked problems that are before us, and we have to really start thinking differently about how we're planning to address them. So the first thing that I want to do is something that I do in all of my presentations, is to offer a land acknowledgement and a big thank you to those who walked before us, specifically those of the Ute, Mountain Ute, Southern Ute, Cheyenne, and Arapaho nations. So the goals for this particular presentation are to offer an example of an equitable and inclusive design and planning process that will purposefully enhance community capacity and sovereignty over decision makings, while also helping projects achieve more successful long-term outcomes. So the first slide that you see here demonstrates the idea of the equitable resilience framework. And this is a formal presentation of a toolkit made by policymakers and for community-led planning and decision-making and communication. It really exemplifies how important it is to have a strong sense of who your community is and to whom is not at the table when decisions are being made. It becomes really important to establish this now, because one of the things we know around, for example, social determinants of health, the reality is so many people have been left and excluded from the table to have this discussion and to be a part of the decision making. So this process of using data to actually determine who needs to be at the table it is crucial that we reach out to people that aren't represented in the data that we use. So I want to explore a little bit to give you an example of using data to support our equitable resiliency work in your communities. And resilience aims to increase the capacity of interconnected systems and communities to respond to a broad range of opportunities over multiple timescales. So the field of resilience, particularly equity resilience, is relatively new and has merged from ecological, economical, political, and engineering fields with a solid foundation of equity. And so it is conceptual, and it has conceptual and organizational shortcomings, operational shortcomings, excuse me. And they remain when applying these resilience to social systems and communities that lead to both procedural and distributive injustices. So a more inclusive and equitable approach is needed for our work. The Norman P. Leventhal Center for Urbanism has proposed a new approach, which is what you see in front of you, the equitable resilience framework. So if you could go to the next slide, please. Here at DOLA, we use our state demographer's office for data collection. And I want to encourage you all to reach out to us. You can go to our website and look under the state demographer's office. Now, with a clear understanding that because we use American Community Survey data and census data, we are often a step behind by a few years. But that doesn't keep you from recognizing exactly what we can use that data for. And so when you contact our office, you'll be able to ask some very specific questions about very specific communities. And we encourage people to use that data specifically when applying for grants and resources at both the federal, the state, and the local level, specifically philanthropic organizations, because it also lends itself to understanding why we have to work together. Because many, specifically our nonprofit organizations, don't always have access to that kind of data. And so we encourage you to reach out to us and commit yourself to using that data. Next slide, please. So the use of the data that we're talking about here comes from the Federal Plan for Equitable Long-Term Recovery and Resilience. And I want to focus on those two areas that talk about belonging and civic muscle and the basic needs for health and safety and I'm sorry, a third one, humane housing, because those are the areas that DOLA is particularly invested in. We are quite, we have been doing a lot of research, particularly within DOLA around, for example, the actual outcomes, equitable outcomes of the American Recovery Plan funding that we received, the state of Colorado received, and how that is impacting our communities. And I have to tell you that we've had some challenges with collecting that data and actually trying to figure out exactly how much of a positive outcome our communities, specifically our marginalized communities, are being positively impacted by our efforts in those communities. Next slide, please. So the 2 points that I want to really focus on that has to do with how can we use this data to achieve the goals that we've set out. And that is, how do we engage our communities? And so one of the things that becomes very clear, especially in the rural communities, is that there's been some limited use of this data to determine or to encourage those voices from those communities that have historically been marginalized and not heard from. And then we use the data to engage our communities in encouraging them to work with local nonprofits, to work with our program and regional managers to develop relationships with local governments to support those outreach efforts. I personally have been actively involved on several committees that are statewide that have encouraged the use of the collaboration of staff here at DOLA with the Department of Public Health and Environment, Healthcare Policy and Financing, Colorado Department of Public Safety. So there are a number of organizations, that other state organizations that we've worked with. And I've also provided support to our local, our regional coordinators and our program managers on how they can use this data to actually reach out and get other community and get smaller local communities to work together. Next slide, please. So I want you to be sure that you understand that you can reach out to me because, like as I said, my specific focus is how do we use this data in communities where we aggregate that data by race, ethnicity, gender, and ability. Those are 4 main communities that we are specifically interested in here at DOLA, and assuring that the funds and the resources that we have available are supporting your local communities in those 4 areas. And I'll be available for questions and comments after my partner, Michelle, finishes her presentation. So thank you very much.
Thank you so much, Jackie. So we will go ahead and turn it over to our other panelist today, which is Michelle Shimamura. So Michelle is the director of the Office of Public Health Practice Planning and Local Partnerships, and she works across the state with the 54 local public health agencies. Michelle has over 20 years of experience that includes leading public health teams, geographic information systems, databases, technology initiatives, public health assessments, and improvement planning and strategic planning. And Michelle has been asked to be on this presentation today because her and her team have incorporated many best practices for ensuring equitable outcomes for improved health utilizing data at CDPHE. So Michelle, I will go ahead and turn it over to you.
Excellent. Thank you. And I think I probably need to update my intro. There's now 55 local public health agencies rather than 54. And one of the things my office does is we work on the state community or statewide health assessment and also public health improvement plan. But we also work with all 55 local public health agencies on their community health assessments and public health improvement plans as well. And so that's really some of the basis and genesis for some of my data work and looking at community level information. So I'm going to go through a series of data points or sets of information. And I know there's going to be a lot of information on some of these slides, but it's really the concepts rather than the specific details that I'm trying to convey. Also, since my chosen profession is in public health, all these examples are health related, but I believe health is tightly related to many aspects of resilience. So how do we measure health? Just setting the baseline for some of the slides up to coming up. Public health is not just the absence of disease in individuals, but it's really the ability for communities to thrive. Like resilience, health can be on an individual level, but a lot of those levers of change for improving health are at the population and community levels. This may include prevention, but also fostering and supporting those protective factors that limit harm when something does happen. So data tell part of the story. We do know, as long as we know what is missing, and that'll be a kind of a theme throughout some of these slides as well. At worst, if we don't dig deeper, it can lead to misleading conclusions or ineffective strategies. The main takeaway is that each data source and data set tells only part of the story. And they're designed with strengths and limitations. And it's not to disparage any of the data sources, but one data source obviously can't be everything. Also acknowledging that data can be a really impersonal way of looking at real communities. As a case in point, the slide that's on the screen, this map comes from America's Health Ranking Report. And they say really early in this report, the real people behind these numbers are what make the work ahead of us so crucial. So remembering that it's the work ahead of us and that numbers represent communities and represent people, even if it's an imperfect representation. So now jumping into the slides, starting at a high level with America's Health Ranking Report, this map shows states ranked by overall health based on 51 measures across 5 categories of health. It measures social economic factors, physical environment, behaviors, clinical care, and then health outcomes. Just looking at this map, it looks like Colorado's doing well. We're in the top 10. So next slide. And then zooming in, there's also a national county health rankings that these are published annually for all counties in the United States. The annual rankings, according to the county health rankings, the annual rankings provide a revealing snapshot of how health is influenced by where we live, learn, work, and play. As we can see, as we start to zoom in, there's patterns and differences in health outcome by county in Colorado. Clearly, some parts of the state have health outcomes from which we can learn more about, right? And we'll circle back around to in a later slide about what goes into these county health rankings and really what constitutes health, and just looking at one model of a health ranking. So next slide. So one health outcome that might be in a ranking is looking at different types of mortality. So we looked at rankings by state, rankings by county, and now we're diving into a health outcome and looking at that by county. There are many dashboards where we can start to dive in further into health outcomes. In this example, this is a CDPHE, the Colorado Health Information Data Set, or COHID dashboard. It shows increased age-adjusted rates of mortality due to accidents. So I just chose one specific health outcome and one type of mortality to show. We could choose a variety of different factors or a variety of different health outcomes to demonstrate something similar. And we see that there's similar geographic patterns as in the prior county health rankings for accidents in Colorado. These accidents include, in this example, transportation accidents, non-transportation accidents related to falls, discharge of firearms, drowning, submersion, exposure to smoke, fire, and accidental poisonings. The rankings can give us a 3,000-foot look or 30,000-foot look at areas that we might prioritize. And the single outcome views such as this allow us to start to hone in on specific subject areas. This also gives us more of a fixed baseline rather than a ranking, which has a baseline that's relative to others. There's certainly certain national-wide shifts that happen to varying degrees across the entire country, and it could mask absolute changes if we only look at our ranking compared to others. All right, next slide. All right, so now I'm starting to zoom in a little closer to more community levels. So here we can zoom into difference at the neighborhood level or census tract level in this case. This map is from the Denver Department of Public Health and Environment from their community health assessment. But these data are available statewide and I believe nationwide too, from the CDC. This shows the life expectancy difference throughout the different census tracts in Denver. I mean, it shows a really big difference between census tracts in Denver. The lowest life expectancy is just over 70 years, in the top center part of this map in the north part of Denver. And then the highest life expectancy is more in the central, kind of southeast area of Denver, with an expectancy that's in the mid 80s. So we know health as well as resilience has place-based attributes. It's not randomly distributed. And this map, while this map doesn't show it, there are definitely differences and disparities in racial and ethnic disparities in life expectancy as well. The interest from a resilience or prevention standpoint is not only this information, but the why and what steps can assist these communities. And next step. So this brings us to the question of what goes into health, what goes into some of these, the maps that we've seen, what goes into life expectancy. And the ultimate outcomes that we often look for, the very endpoint outcomes in public health are, length of life, so mortality, life expectancy, and also the quality of life. This is just one model. It's used by the county health rankings from the second map that we saw. It takes into account that policies and programs impact health factors, which they identified as health behaviors, clinical care, social and environmental factors in the physical environment. And each of these factors then has components that go into those measurements. Next slide. But what we haven't seen in the data so far, and it is more difficult to measure, is the impact of the arc of time on a community. So this is a high-level map that shows neighborhoods in Denver. This is also from Denver Department of Public Health and Environment. The solid colors are the overall equity index measured for each Denver neighborhood. The darker blue areas, so this is just the solid colors, the darker blue areas show areas of more inequity, and then the lighter blue and the yellow areas in this map are areas that have less inequity. So then overlaid on this are the diagonal lines, which are the historical redlining grades. The next slide just zooms in a little bit so you can see a little bit better. So go ahead and get to the next slide. So the red diagonal lines here in this area are the areas that were redlined at the most severe level and deemed hazardous. One thing that's very interesting, they correspond with some of the high inequity areas of today. And I know somebody one of the prior speakers today also talked about redlining. And this redlining information comes from the Mapping Inequality Project. They have scanned documents of redlining in several cities throughout the United States. A few years ago, they had a redlining exhibit. And so I very much encourage people to go and explore that information as well. I have a link in there. So if they send out the slides, you can explore the redlining information, that historical information as well. Right. And so there's the arc of time that's not always captured, as many people know. And then within communities, and even within geographical communities, there's different experiences and situations that impact health. A key concept here is that only looking at information in aggregate masks many important differences, especially in race, ethnicities. In this example, wealth is not evenly distributed, and we all know that wealth does improve access to resources, and resources are an important aspect of health and of resiliency. Next slide. So I end with this slide, and I put ground truth in quotes because it doesn't exactly convey what I mean here, or the concept that I want to convey. The important concept is that every component of resilience is often not mapped or measured with standard data sets. Right? We don't always know the formal and informal community resources, other benefits, challenges, etc. within a community. So in this way, ground truthing the data or establishing how data align with specific situations as experienced by people is a really critical part of this work. We recognize that the way data is gathered and interpreted frequently is influenced by longstanding institutional and systemic biases. What information is held within the community? And in some cases, it may be specific community protective factors or community resources. In others, it may be larger data sets. Tribes, for example, have the right to share or not share with state and local governments. Improving community resilience requires us to partner with these communities and think about communities through that arc of time, but also as multidimensional entities. Not only to kind of quote unquote ground truth the data that we have, but also to really gain awareness of what we don't have and what we don't know. So rather than ground truthing, it is the information originating from the ground and from the people. And I really think about it as the information that comes from sort of these top-down standard data sets, but also that information that could come up. And they're both extremely important to have. And if we only have one without the other, we're missing a large part of the story about communities. All right. And thank you.
You're on mute, Shale.
Thank you, Jemmy. So we are now going to open it up to a quick question and answer before we jump into our group discussion. Unfortunately, because of the fact that we had some glitches with the breakout rooms, we're not going to be able to do as much discussion as I would have liked to have done. But we do want to give folks the opportunity to ask any questions. So feel free to put your questions in the chat, or you can raise your hand and we can make sure that you're unmuted. So does anyone have any questions for either Jackie or Michelle? All right, maybe that means that you both were so thorough that no one has any questions. If questions come up, please feel free to put those in the chat as we move along here, but we will go ahead and open it up to group discussion. So folks are welcome in the audience to turn on their cameras if they want to. You don't have to by any means, but I know some folks like to be able to see faces, so feel free to turn those on at this point in time because this is a group collective discussion. And we will go ahead and drop the Jamboard into the chat. So for folks who are not familiar with how to use Jamboard, it is basically an online sticky note exercise. So Jemmy, can you go ahead and share your screen with the Jamboard so that as we walk through the instructions, people are able to kind of see what I'm talking about? Thank you. So as the Jamboard is opened up here, basically we're going to kind of group our discussion into these three key areas. So for folks who are opening the Jamboard on their own, up at the very top, you will see the different slides. So all of us are using the same Jamboards essentially in the breakout sessions. So please go to slide number 3 if you are in the Jamboard yourself. Otherwise, if you want to just contribute to the conversation here, we're happy to put a sticky note for you. On the left-hand side, you see a whole bunch of different options in that little sidebar. To use a sticky note, you'll click the one that looks a little bit like, I guess, a sticky note, for lack of better terms. So you'll click that, you can choose whatever color you want, and you're able to directly provide your input there. So the first question I have for everyone is, 1 second here. What are current success stories and or resources or tools that you are all using at the local level as it pertains to equity work from a data-driven perspective? Is there anything that anyone wants to share here in the chat or add a sticky note that they are contributing to at the local level? And again, feel free to come off of mute if that is something you want to do as well. We don't only have to use the chat feature.
Hi there, this is Ricardo Perez. Hey, Shell.
Ricardo,
Good
good
to
to
see
see
you.
you.
I'm trying to turn on my camera. Jackie and Michelle, thank you so much for all that information. Yeah, I'm an emergency management coordinator over here in Larimer County. Previous colleague of Shell when she was over here in Larimer County. But yeah, I thought it was super interesting just to learn how to kind of analyze some of the things, some of the barriers that you know our local government can have in just the normal ways that we do public information, some programming with different departments in the county, and having that awareness of that we need to do kind of simultaneous work of understanding the barriers that are internal processes and how we conduct outreach and engagement with the community, and then while kind of being on the ground as well as much as possible, identifying community champions, starting to build some of that trust that local community organizations have. But yeah, some of the work that kind of Shell started when she was here at the county is really kind of shifting the way that we conduct engagement with the community, learning more, listening, being humble, and knowing that some of the things that we learn might not be exactly what we're expecting, or great things that can be positive if we have an open mind and we kind of have the perspective of growth in some way. But yeah, definitely having the perspective to make things as easy as possible, as accessible. Things are not perfect, but definitely the data piece. I'm a big fan of data. But yeah, learning what kind of data is out there that is useful, and that leads to action. So yeah, some of the work that we're doing in Larimer is kind of a community resilience assessment and working with our local health department and their community health improvement plan, their committees that they have, continuing to do outreach in different languages and in Spanish, and then seeing what other needs there are in other languages for the county. So yeah, there's a lot to do, but yeah, I'm grateful for kind of the summit show. Great speakers that you have, and thank you for putting it together. But thank you, Jackie. Thank you, Michelle.
Oh, thank you, Ricardo. I really want to support what you're saying about how we need to use this data in our local communities. Because one of the things that neither Michelle or I talked about that is really crucial is, who are those people that we haven't counted? Who are those people? Because they end up being the folks that we have to spend a great deal of resources on when we have a disaster or when we have a crisis. We've learned that in the last month here in Denver, that not all of the people who live here are counted. And we have to really be conscious of, how do we go about reaching those individuals? And one of the things that I spend a great deal of time on with our CRO team, as well as our regional managers, is, are you all reaching out to your local faith-based communities? Are you reaching out to those nonprofits that are working with people with ability challenges? Because those are folks who we've historically, in addition to those folks of different races and ethnicities, that we've ignored. And so I really encourage people at the local level to really reach out to those other communities that have intimate knowledge and connection to those communities that we've heretofore kind of ignored.
And I second that. And I think one of the challenges, and I put that as a sticky note too, is having that consistent collaboration and on the ground. So it's not just necessarily going to communities when we're doing an assessment, right, every 5 years, like then reaching out, but really having that consistent on the ground connection. And I think that's a crucially important part that doesn't always get built into the system. The system being the government, where most of us or many of us work.
Great. Thank you so much, everyone. And thank you, Ricardo, for the kind words. I promise I didn't plant him in the audience. But Larimer County is doing some really awesome work, and it's really cool to see that continuing. Is there anyone else that wants to share an example of something that they are doing at the local level where data is driving the outcomes that you're looking for? All right, well, maybe let's talk about some key challenges that local communities might be experiencing in this space. What are some tools or resources that would be helpful for you all in trying to engage in this kind of work? And what barriers might you be running up against that you would like to discuss in this larger group setting? So I'm seeing on the Jamboard that there is a need to be consistent on the ground work and collaboration, and that just genuinely or generally support that is needed is the general helping of local governments to start having data-driven conversations. So Jackie or Michelle, what advice might you have for people who are just starting in this work or are looking to start having these types of conversations?
I think my first answer is to let me back up for a minute, because one of the things that Dr. Carcassonne said that I'm really fascinated about is that these wicked problems are steeped in the idea that we struggle neurologically to connect with one another. And so I have really been talking with colleagues and students about how you can address your knee-jerk response to people who are different from you. I'm a little concerned that we're teaching people that anthropologically we're all fearful of one another. And I don't know that that's true anthropologically, but I do know it's true in our current society. And so what does that mean for you when your primary focus in your life, whether it's work or in your daily life, is reaching out to people that you don't generally reach out to? And so I have to also mention that it becomes really important to you do some social emotional work and neurological work on your own, so that that fear or that anger or that anxiety or that implicit bias that may come up when you start to do this work, it's really okay to reach out to folks who are doing this kind of work in EDI and talk that out. Because otherwise we're going to have the same kinds of struggles we've had all along with not inviting those important people to the table to add to our conversation. And so I don't want to ignore that this can be an emotional process, and that you should not seek support in dealing with that process. We have a real fear here in the work that we're doing now, that somehow having an implicit bias is a negative thing. It's pathologizing, and that's not true. We just encourage you to recognize that, and then use that same energy to reach out to people, to actually expand your community, so that it doesn't include, or so that it does include, a lot of people that don't necessarily look like you or talk like you or have the same abilities that you have. So that's when you ask, what are some ways to do that? I want to encourage you to start with that piece about, okay, if you have implicit bias, there's nothing wrong with having implicit bias. What you do with that implicit bias is what's important, because that's what gets us to this place where we end up we struggle with developing policies and resources to address those individuals that we don't see every day. We call them those invisible folks. And it's amazing how just color or just ability or just language makes people invisible based on our neurological prospect, our neurological framework. And I think that's what piece of what Dr. Carcassonne was talking about. And that, so I want to encourage you to reach out to us here, even here at DOLA, because we do provide that kind of support to you. We do that for our staff, and we do that for local governments to address how do we deal with those implicit bias in a way that it doesn't become a barrier to the work that we want to do.
And I want to acknowledge too, there's a few comments too on it's on in the chat and then on the board as well. A lot of questions on kind of rural Colorado and what does that look like. And I think the approach is very similar, even in a maybe relatively homogenous county. There's different communities, right? And there's communities in there, and in I think any county that maybe aren't heard. Right. So it's really looking at where are those communities and what are their needs, and how do I make those partnerships. So I don't know that it's necessarily a different approach. It might look different and some of the communities are different, but there's certain vulnerabilities within. I know rural community has many struggles as well, and many barriers and many opportunities. And, you know, and on their slides too, is kind of thinking about the arc of time over which is not captured in a lot of data sets, right? But that is also something that isn't necessarily geographically specific, right? There's a time factor and an evolution factor throughout Colorado. So looking at that as well.
Great. Also, we're looking at, you know, how to address data gaps, right? And thinking through what that looks like for people, and that there might be some sensitivity around wanting to share data, and thinking about people's rights in that regard, and how to address those data gaps while still respecting people's privacy and safety. So especially for local governments that are wanting to be more impactful in the work that they're doing, but are maybe running up against that as a barrier, what advice might you have for them and how they start navigating those types of relationships? All right, and so the next question is really looking at balancing historical context with transformational change. So we just kind of touched on that, Michelle. But what are some examples of how we may have or may not have met those existing challenges, and how can we continue to make progress in addressing future challenges that may be not yet known? And Michelle, I don't know if you have anything you want to add to that.
You know, I don't. And that's a big question. I don't think it has a simple answer. You know, I think it's a work in progress, and I think somebody said earlier, being humble to learning about communities and learning about what those communities went through, not just in this present day or that individual, but in historically in the past, and recognizing that I think lots of times our society and I think myself as well, right? We're very interested in present and how do we make things better in the future, but I don't think we have to build in the past into that as well in any of the areas, in any of the areas of Colorado or geography. I think the past is a really important aspect that we stand upon, right?
Great, thank you so much. All right, well, we are going to go ahead and start closing down the breakout room. So thank you for everyone.